Living East Tennessee, I'm Erin Barnett. Dr. Milligan here from Milligan Veins. Thank you so much for coming in today.
Thanks for having me here.
All right, so this is a topic that not always people want to talk about, varicose veins, but we have it, we deal with it, it is life. What can you say to people to finally take this seriously?
Well, everybody thinks about vein disease as just being varicose veins. It's actually more to that. It's not just the women that have the ropey varicose veins or the guys. It's also the people who have restless legs at night, heaviness, achiness, Charlie horses, and cramps at night. It's game day weekend for Florida, so people are going to go to the tailgate, and by the end of the game, their ankles are going to be swollen. The legs will weigh, 50 pounds.
You start to feel that.
Yeah, the heaviness and tightness. And then at night, their legs are going to ache and cramp.
Yeah, so if we start to see those creep up on our legs, we really need to pay attention to how our body is responding.
Most definitely. It's, pregnancy is a risk factor, obesity is a risk factor, jobs where you sit still too long, stand still too long, all increase the pressure down your legs and can make those veins stretch out and the valves not work.
And we're busy people, so we need to take the time to not only pay attention to that, but there's some things we can do that can help.
Correct, yes. So treatment, you can start off with a compression hose or elevate your legs, but then we offer office procedures, which are quick 15 to 30-minute procedures that seal those veins that are leaking off and allows your body to reroute the blood back through the healthy veins. My average patient says they're somewhere between 70 to 90% better. They don't have the aches and cramps at night. Their legs feel lighter with more energy. They walk better. And on top of that, you'll look better.
Yeah, because I'm starting to not only see them, but I'm getting that little pinch in the side of my leg. That pain can get worse over time.
Yes, or else you feel the little bugs crawling in your legs and there's nothing there.
All right, so these procedures don't take very long, and I think that's important to note.
Correct. If you remember, people think back to their grandmother had veins and they were stripped back in the old day.
Right.
That grandma was in pain for 6 weeks, and the
recovery was a lot longer.
And now you're back to work the next day and your legs are feeling better.
That's amazing. So little things that we can do at home to help with this, because we are on our feet a lot, then we sit a lot, and we kind of are guilty of making this worse sometimes.
Right. So basically it's elevation, compression hose, and have them treated.
All right, so come to the experts.
Yes.
And when will we know this is serious? We need to take care of this. Well, it's not just a cosmetic thing.
It's not just a cosmetic thing. It's, you start having the symptoms. Your legs are heavy and tired. You can't, have to get up and walk around because they're starting to ache and cramp. Those are all symptoms. And as we age, things get worse in our body. So the veins stretch out, and over time, by the age of 60% of women actually have leaky vein disease and start developing the symptoms.
And it's not just women too.
It's not just women. The guys have it as well. The guy that walks through Walmart with the brown legs, he has vein disease.
Okay, so people can come into your office and get a look at how serious their issue might be.
Yes, come see us. We'll see you and then evaluate you with an ultrasound to show directional flow of these veins. And that will tell me kind of what I can offer to help you make your quality of life better.
And I know a lot of people recommend changing up the shoes, because I do like to wear my heels a lot.
Yeah, life has to go on. But we can tweak it here and there to, give you a better quality.
And I love that you were saying how much better people feel when they take care of this issue.
Yeah, my average patient's between 70 and 90% better.
Oh man,
so
I need
they'll
to
have more
come see you
energy.
guys.
They'll be go hiking again, and they can stand still without having to pace around.
Yeah, because I do tend to feel that pain, like I said, and you rub it, and then it comes back later in the day.
It's like a dull ache.
Down.
Yeah, and when you lay down at night, you'll that's where you really feel it. Those veins have been stretched out throughout the day due to too much pressure. When you lay down at night, they kind of go into little spasms.
Okay, and tell people where they can find you all here in town.
So we actually have an office in Knoxville, one in Crossville, and another one in Morristown.
Oh, so plenty of locations.
So plenty of locations
to
try to make it more convenient.
Yeah.
But you can find us on milliganvein.com for phone numbers of the different offices.
And this is what your team does best, so they're going to get
their
their
one thing
questions
and only one
answered.
Thing.
Awesome. And how long have you guys been in town?
So Crossville since 2011.
Wow.
Here since 2015.
So you've seen a lot of patients here and been able to help them.
Yes, I've done over 10,000 vein procedures.
Awesome. Well, Dr. Milligan, thank you so much. I think I need to make my next appointment.
All right, well,
I'll
thank
be
you very
calling
much
you guys. And
me.
of course, and we will have much more information about their offices and the treatments they have on our website, livingeasttennessee.com.